Alex Azar, Donald Trump's Health and Human Services Secretary, is lying about Obamacare again. Shocker, right? So, speaking to a virtual health summit sponsored by The Hill, Health and Human Services Secretary Alex Azar answered a question about the case the Trump administration has filed in order to eliminate the Affordable Care Act. So now I've reported on this before. The Trump administration, during the middle of a pandemic, is saying, hey, we got a great idea. Let's get rid of Obamacare. Are you kidding me? Really? Okay. So now Azar is saying, oh, but don't worry. We're going to protect pre-existing conditions. Well, okay, but how are you going to do that if you get rid of the ACA? And you don't actually have a plan to protect pre-existing conditions. But look, that's what Donald Trump's saying. He's saying, I believe in the pre-existing. We're going to get the pre-existing. We're going to protect that because that's really popular. Well, it is really popular. And so, yeah, understandably from a political standpoint, you'd want to protect pre-existing conditions. But the ACA is actually more popular than it is unpopular. But again, among Republicans, they still see it as Obamacare, Obama bad. And Donald Trump says Obama bad. And so they want to get rid of it. So now Azar says, well, don't worry. If we get rid of it, we're going to save your pre-existing conditions. They're going to be in place for everyone. That, of course, is the complete lie. Now, they're making the case in court, and it gets a little complicated, but they're saying, well, the thing that protects pre-existing conditions that isn't in Obamacare is HIPAA, the Health Insurance Portability and Accountability Act. They say that it would ensure that people with pre-existing conditions would not be denied health care or health insurance. Again, that's not true. Kaiser Health News took a look in this, and here's what they reported. HIPAA's original purpose was to end what was known as job lock, a situation in which people with pre-existing conditions were reluctant to leave their jobs with health insurance, even for other positions with health insurance, for fear that their conditions would not be covered or they would be subject to long waiting periods. For coverage, of course, that happened a lot, right? Back in the day. Now, HIPAA sort of addressed that problem as long as people maintained continuous health insurance coverage, defined as having health insurance for at least 12 months without a break of more than 63 days. So there's some obvious problems with that. People who met that requirement, of course, could not have waiting periods or denials of coverage imposed upon their own or a family member's pre-existing condition. And so that is like a very, very light protection, right? Very light protection. So now, look, HIPAA also, of course, protects the security and privacy of the patient, but this is another part of HIPAA. So it's just one that you don't hear very much of. And so this part of HIPAA was designed to have a little bit of security as you're changing jobs to make sure that when you get your new insurance in your new place of employment, you don't get denied for your pre-existing condition. However, it was not designed to make sure that people could not be denied coverage if, in any other circumstance, essentially. Now, the ACA actually tried to go and fix that, but there was, of course, a little bit of a problem. And so now, they went to go and fix that because that was a problem. And so the ACA, it's one of the things that it actually did well is to protect people with pre-existing conditions, at least on that. Basically saying that you can't deny people insurance coverage based on pre-existing conditions. You have to still offer to sell them insurance. Now, there were other reasons that people couldn't get insurance before the ACA, or even if they had it, of course, use the insurance. But back to HIPAA here. The problem is the protections were only for people who already had employer-based insurance to make it easier for them to move to other employer-sponsored insurance. It did nothing for those in the individual market or for people who are self-employed or working for companies that didn't offer health insurance. If you were in any of those categories and you had a pre-existing condition, well, then you were screwed because HIPAA did jack for you. Now, Go to today, right? So now we have the ACA. But if the Trump administration dismantles it, well, then we're going to have a worse situation because right now we have 40 million people who are unemployed. We have 5.4 million people who have lost their employer-sponsored health insurance. Now, COBRA, right? You might say, well, they still have COBRA, right? Go and sign up for that. Well, there's problems with that too. COBRA only allows individuals to continue their employer-based coverage for up to 18 months if they're able to somehow pay the entire premium themselves plus an administrative fee. Wow. So that's without your employer contribution, which makes it prohibitively expensive for families, especially ones that have just lost their job. And look, even if a former worker was somehow able to pay for COBRA, maybe they got another job, I don't know, until that 18-month period ended, there was no limit after that 18 months on how much insurers could charge for the conversion policy. And so, again, that adds to the cost. Not only that, but COBRA coverage is also not available for people who worked in small businesses or for those who became unemployed because the business they worked for failed because of COVID or no longer offered insurance. So HIPAA also does not stipulate which benefits had to be offered. So, I mean, of course, that was a terrible program. It's still a terrible program today, and it doesn't cover people with pre-existing conditions the way that the ACA does. Now, the ACA did rewrite HIPAA provisions regarding pre-existing conditions to, a little bit of an extent, right? Offering them a little bit more coverage. But if the law is struck down, then would that change stay in effect? Or would it go back to what it was before? And so that's the question, right? And we don't know. It's very possible, according to experts, that HIPAA's protections would be eliminated along with the ACA, those rewritten protections for people with pre-existing condition. And then HIPAA would go back to what it was before when it was basically signed into law by Bill Clinton. And so what Azar is saying is a complete lie. So now it's amazing to me that not only can this administration lie openly about pre-existing condition protections in order to strike down the ACA, they're using that to help strike down the ACA to make their argument. And they're doing so in the middle of a pandemic. Now, look, I thought the Democratic Party was a little bit tone deaf by not adopting the obvious solution, Medicare for all. Like, Medicare for all during a pandemic, makes sense. It is the only solution. I mean, yet the establishment Democrats are lying about Medicare for all. Oh no, it's gonna kick people off their insurance at a time where they at least need to be kicked off their insurance. That's not true at all either. They're fighting against it because, of course, they take money from health insurance companies. And they're also fighting against it a lot harder because, guess what? It's popular with Democratic voters. And yet Republicans, they looked at what the Democrats were doing in fighting so hard against single payer, and they said, oh yeah, hold my beer. Let's get rid of the ACA. What are you doing? I mean, as inadequate as the ACA is, because of course it's the Republican Heritage Foundation plan, there are some good provisions in it that have helped millions of people. One example is the Medicaid expansion. Wonderful program. I wish it could have been applied to everyone. Originally, they said it was going to, but then the Supreme Court said, no, you can't do that. Only states that have opted into the Medicaid expansion were able to do so. And most states, fortunately, have, except for some, of course, Republican states that still, obviously hate their constituents. And so they haven't done that. Not only that, but again, you have the pre-existing condition provisions. I still think that the ACA needs to go much, much further. We need a single-payer healthcare system. We need to eliminate private insurance. I want to be freed from the goddamn middleman. And that's all private health insurance companies are. They're a middleman set up to basically bleed me of money. No, we're not interested in that. But until we have a progressive Congress and a president who's actually willing to sign that into law, and Joe Biden is not that guy, we do have to prevent Republicans from tearing down what little we do have. They're taking us backwards. I mean, look, the ACA may have been only one step forward, but with the Republicans, we're going to take 3 steps back. And that sucks. And so we can't do that. I mean, we'd lose the Medicaid expansion. We'd lose the pre-existing condition coverage. And that's unacceptable. Completely unacceptable. We need to keep it and expand on it until we get single payer. I don't care how we get it, whether it be, incremental, or if we're to get it, because of a massive public action. I think that we should probably go for the massive public action first and protest in the streets during a Biden administration for healthcare for every single man, woman, and child. But as long as we get it and are able to cover the millions of people, every single man, woman, and child in this country with healthcare, we need to fight for it. But first, apparently, we got to make sure the Republicans don't take what little progress we've already made. It sucks, but you got to do what you got to do. And so Trump and the Republicans, they're showing you exactly what they're about by killing the ACA in the middle of a pandemic when millions have lost their health insurance and have lost their incomes. They want to make it worse because they don't care about the people. They are a death cult, and they're more than willing to sacrifice you for a profit. Hey guys, hopefully you enjoyed that free video. Now I'm going to have to ask you a favor. Between the demonetization and the YouTube algorithm messing around with view counts, etc., we're having a hard time adjusting to the new YouTube reality, which is where you guys come in. See, we have a patreon.com/TYTNation set up to help us rely on you guys, the viewers, instead of big corporate ads. Look, you know the show. You know I'm not in favor of big corporations anyway. So help us transition away from relying on the ad model to pay the bills and sign up to be a patron, patreon.com/TYTNation. That goes a long way to help us keep the lights on. And you guys will know that you're supporting independent progressive media.